The sound and music in a psychotherapeutical setting, research on sound neuromodulation. Music in a psychotherapeutical setting is used to stimulate the patient's contact with their emotions to produce unconscious material and free association, of course helping the patient to verbally express themselves. This is the case of using receptive music listening, for example, or we could use in the session guided visualization with music. Psychotherapy with a live musician within the setting is also a technique that is quite used in my psychotherapeutical practice in Amsterdam. Yes, indeed, I come to the conclusion that it's important to use music in the therapeutical setting, also because several studies have shown the benefits of listening to sounds and music on people suffering from a variety of mental illnesses such as depression, autism, and anxiety. The introduction of, in this context, of a device of neurosound modulation like the EPAT, the pink noise, which is actually patented and copyrighted, was a choice that is exactly in tune with my experience. I'm very proud to introduce you the experience I had in the therapy practice in the last 3 years in Amsterdam, where the sound neuromodulation with the EPAT in patients with tinnitus and psychopathologies proved useful in the following areas: the chronic pain and tinnitus reduction, producing vitality, for example, in patients with depression or with burnout, to stimulate memories when there is shock or traumas, or a dissociation as consequences of a traumatic experiences. Also in epigenetic traumas, I could stimulate memories with the EPAT. The reorganization of dysfunctional thoughts, for example, in a pattern that the patients repeat several times, sleeping problems, and so on, those can actually be very useful. They use the EPAT towards the reorganization of dysfunctional thoughts. Recognition of maladaptive patterns, for example, this is also very important because the recognition of a certain behavior can also change the behavior. And this is the first step. Resolution of emotional blocks and reactivation of fast decision making after an illness like depression. 2 million of people at the moment are suffering of tinnitus in the Netherlands. So that's why this theme, not only in the Netherlands but also in all over the world, is quite a delicate theme to treat. Together with Dr. Guber Finsterle in Milan, I could follow training and learn a new method which treats this disease. The method consists in 6 sessions as a first start, and the patient has to be very engaged and motivated, in fact, because it is a long treatment, it is a short treatment which will take a lot of long-term changes. During these changes, we are going to see the first session on a Monday, for example, the second session on a Wednesday, and the third session on a Friday for 2 weeks. And during this period, we can see the following changes. The first sessions, the patient will listen for 24 minutes of sounds, and the sound is a pink noise, and Dr. Finsterle explained very well what it does and how it influences the brain, and is going to create a neurophysiotherapy, so-called sound neuromodulation, which is going to influence first the limbic system, then the cortex, and at the third level also the frontal lobe. I come to use this method in psychosomatic psychotherapy because I realized that what AVS research in Milan have discovered is not only a way to treat tinnitus and its related psychopathology, but also a method to create a reset in the brain for many different diseases. We are going through a time in which stress is and burnout are one of the biggest diseases in society, and it's very difficult to ask a client to stay for 1 year or 2 in therapy to prevent or to support the burnout and cure the burnout. So through this therapy, the client is taken to a mindfulness level of relaxation, and through these 24 minutes of pink noise, can really find a condition of relaxation, and then the psychosomatic psychotherapy after will be just a support for the client to understand what has happened during the session. Why we talk about what has happened during the session? On the psychoanalytic and psychosomatic level, during the session, the client reach an altered state of consciousness, which is very difficult to reach in psychotherapy, so you need a lot of time to do that, which is a minimum of 6 months of committed weekly therapy. And also, when there is a connection between the therapist and the patient, what happens is that that can create a dependency from the client towards the therapy. But with the psychoacoustic, because the altered state of consciousness give thoughts to the clients which are completely independent, there is a sort of unconscious material that goes through the brain of the client thanks to the stimulation of the brain, and this can of course give material to the sessions and help the client to bring a sort of life experience that can change also the maladaptive pattern in the brain. I have a very good experience in using the psychoacoustic transitional sessions with patients with tinnitus. The patient with tinnitus is in pain, it's in chronic pain, morning and evening, and has no control at all of the sound. It can be high, it can be low, and this can influence relationships, sleeping patterns, can have work-related issues, and of course, so not only the individual but also the full context around him is influenced. So when it comes to the therapy, it comes with the hope that this can work, but he already have been trying through different other therapies, other systems that didn't work. So there is a motivation but also little hope. What I see after the first sessions is that the tinnitus changes. And because the tinnitus changes, it can be higher or can be lower, but the client has an impression that there is a variation of the tinnitus. Then during the therapy, this variation can be higher and lower, and by signing and writing how much it can be higher or lower, we can see if there is a changes in the tinnitus. We know by the researches of these last 20 years that if it is a change in the tinnitus, is more likely that the tinnitus can go away. And how it goes away, in my experience through seeing the clients, it just becomes higher and more acute, and then slowly disappear. But what if it doesn't disappear? Well, if it doesn't disappear, the thing is that the client has a therapy where he can go after a party or concert, because clients with tinnitus don't go to concert anymore, don't have long conversations anymore, because the sound is too strong after a higher stimulation or big emotions or situations that could change his mental status. So, and also his hearing and the sound that he absorbs in his hearing. So what happens is that with the therapy, he can have control. So there is a control of the sound, and this can reduce anxiety, depression, increase social life of the client. So for example, he can decide to go to a party and then have the therapy the days after. And with that, he can go back to his habits, going to the cinema and have a more adapted life. This is also if there is a lack of sleep or if there is other symptoms that I didn't mention, but at the same time those are reduced. It's not only reduce the tinnitus, the psychological approach to the illness is different, because it's not considered anymore an illness without a cure by the patient. He knows that there is a cure. So thanks to that, he can decide to do the intensive therapy of the 6 sessions, then do other 6 sessions, and then to continue with retuning, so that the brain can repattern again to adapt himself to hear the sound, correct the sound, and by correcting I mean absorbing and understanding the psychological effect of the sound, and from there trying to find a balance in his life. In my experience with the tinnitus, most of the time the doctors says that there is not a real relations between something that has happened and the tinnitus. In my experience as a therapist, by seeing several patients with tinnitus, I noticed that more patients have had traumas or psychological stress and burnout before the symptoms, and the tinnitus kind of functions as a regulator for the life of the patient. And this is an important information because through the 6 sessions and the methodology of the psychoacoustic traditional sessions, we could see different phases. In the first session, as I mentioned before, the patient is happy to have an experience of changes during the therapy. Through the second sessions, I call the opening of the Pandora vase, because the patients go through flashback when he had his development. And when he has memories and flashback of his past, basically he goes through all these traumas, but the psychoacoustic help the patient to relive the trauma. It's not remembering or seeing it, it's a proper dream in which the client goes in and has the power to open the eyes if he doesn't want to see the images, or close it again to go through the images. And then through these flashbacks that could be visual, psychological or physical, then he can find a solution through the trauma in his own brain during the sound. For example, if a patient is seeing through the therapy that is falling into the river and into a pipe, then it's going to go out from the pipe during the vision. And this is, of course, a sort of a metaphor of a tunnel, and then how the client can go out of the tunnel. During this experience, if the patient have had panic attacks, claustrophobic disorders, or depression, then of course he can see himself finding a resolution, and he will finish the session with information about his own persons and his own traumas, but also a reduction of the tinnitus. The combination of the two is very important during the therapy. Of course, by re-experiencing the trauma, he is emotionally independent because you could see the client crying or shaking, and all the physical sensations are visible, and it's a proper trauma therapy, because when the patient comes out from the session, he feels lighter, relieved and stronger, and this experience he has had it on his own. This is an important part, and of course the question that could raise is where do we locate this therapy? It's a music therapy, it's psychoanalysis, it's a method that everybody can use. Well, of course, there is a training needed, like a doctor or a psychotherapist, indeed. And it is also important to understand that those altered state of consciousness can create a moment which has to be managed by the therapist. And that's why we are there. If you think of the guided imagery and music, or the Boni method, which is, of course, known in the whole world, there is a pattern of sounds that the patient is going to hear, and this is going to influence constantly the emotions of the patient. So you have music for the client, for depression, for anxiety, for stress, and so on. In this case, you have the same sound that, due to the stimulation of the brain, create all this independent resolution for each client due to the replasticity of the brain, and this happens during this neuromodulation. So let's say that in the psychoacoustic, compared to the guided imagery and music of the Boni method, there is a known sequence of events that is going to happen in the brain, and also results that can be measured in the psychotherapeutical session. Of course, the second question also is regarding the music therapy. Is it a music therapy or not? This I obviously leave to the specialist in music therapy and to give the answer. In my experience, of course, the music therapy is more active if you consider the improvisation and the music making, or it creates, of course, an experience of being passive during the sound experience. In this case, the stimulus is always the same, and that's why it's easy to scientifically see the results, and this I find it really important. The psychological and psychosomatic implications of the patient of tinnitus are very severe, and most of the time not very visible outside, because the client has a sound in his ear and he cannot very explain to other people as much as people with chronic pain. So of course the problem can be social issues, so that the person cannot go out and visit the friends, he cannot go to the cinema or go out to concerts because the tinnitus constantly changes. So the patient can develop social phobia, high anxiety, depression and suicidal symptoms. These are the most severe, but we also have seen clients with obsessive compulsive disorders and of course problems with work and difficulties in reintegrate into society and life like before. The immediate effect of the psychoacoustic transitional sessions on the patients with tinnitus, it's an immediate relaxation of the body and the brain. It's like the patient have been in a status of mindfulness. Most of the thoughts, the repetitive thoughts and pattern of the thoughts are released, and there is an immediate smile on the face, and this is because the client usually find difficult to detach from the sound. Most clients I've met, they try even with the sound of the Hoover or of a particular music or the rain, to try to distract themselves with cognitive behavioral exercises. But at the end, this is temporary, and the 24 minutes of psychoacoustic transitional session basically give to the client a positive result, or having the brain free from thoughts and a body relaxed, and also the phobic disorder and the fear that the sound can increase without their control is much reduced. And this, of course, it is very much a sort of an antidepressant, because if you repeat it 2-3 times per week, it works as a medicine for the client. The long-term effect of the therapy on a patient with tinnitus is, first of all, a constant relaxation and peace and reduction of stress towards the symptom. So the symptom is integrated into the life of the patient, with less anxiety and less tension in the muscles. For example, if a patient has to wear earplug because the sounds are too strong, of course the body can kind of shrink, and all the muscles can be in pain. And if the patient is more free and less afraid that this sound can affect his body, and has a knowledge that this sound can reduce with the therapy, then all the body is more relaxed. There are more positive thoughts in the brain, and in the long term the patient finds himself more active. If he wasn't flying anymore, for example, he would fly again. If he wasn't doing certain exercise in the gym because he was afraid of giving too much stress to the body, he might find himself doing it again. The most important information is that he is able to know that there is a therapy that can change or reduce it, which until now it wasn't possible. Something also very important in the changes is that he becomes more independent in his self-care. So because the psychoacoustic transitional session also help the decision making of the client, he becomes much more fast in making decisions. So if before there was a social conditioning in which he would say, oh yes, of course I will come to the cinema, on a psychological level he will think within himself, is it good that I go to the cinema? Is my stress level reached already, or do I still have energy? And with this fast decision making, the patient can make better decision for himself and protect himself towards a better self-care. It's very important for the client to have retuning. This is usually done monthly, but accordingly to the reaction of the patient to the treatment, it's better not to assess at the beginning, but during the therapy understand what the patient needs. For example, I had a client that was a doctor and he was in treatment for depression due to psychosomatic stress and frequent flights in a plane. And during the psychoacoustic transitional therapy, he could meet heavy trauma that he had in his childhood that was really detailed and described in the images and had a profound emotional impact on the client. After the first session, the client didn't have anymore the protection on his ears, and he wasn't disturbed anymore so much from the sounds outside, and was more open, so he could indeed have more social life stimulus. Also because the profession, he was a doctor, then he had also less stress during the meetings with the client. Concerning the reduction of the tinnitus with a weekly repetition of the psychoacoustic, now the tinnitus is under control. There is of course much more balance. The intensity is reduced, and the patient found a new balance with a minimum psychotherapeutical intervention. Of course, I say that also the acoustic thoughts helped the patient to kind of feel all the emotions in a different way related to the trauma, and the connection between having a psychotherapeutical support and a reduction of the tinnitus changed the lifestyle for the better. The second case study I want to present you is a patient DR, is a female, 37 years old, and she's a photographer. She suffered of chronic pain and depression, and she's in treatment for severe cheilitis on the mouth and chronic pain, anxiety, depression associated to high-functioning Asperger's syndrome. After having been to university hospitals to treat the cheilitis, she has been told that there is no cure, and a little psychological support could help her going through the illness to accept her condition. Of course, she and her husband tried everywhere to find solutions, and then they end up in my psychotherapeutical practice, and we start a psychosomatic psychotherapy of at the beginning once a week, and then twice a month. And there is introduced the psychoacoustic transitional sessions with the intensive therapy of 2 weeks, and then continuing with the sound therapy of the psychoacoustic. Of course, because the illness was defined by doctor uncurable, and as well the associated mental health as chronic, the patient came with little hope, and was very difficult to create a good psychotherapeutical trust, and through the psychotherapeutical trust that we could build, we could also start with this therapy. During the sessions, she could envision very well the trauma that she had at the age of 3, in which the family moved to the US for the university job of the father. The patient relived the experience of traveling by plane and immediately feels sick in her stomach. She remembers to have felt forced to go and powerless in this decision. This pre-verbal trauma and the change in language into the new country create an issue in understanding and naming her emotions. This block in the capacity of express them could be one of the cause of her psychosomatic block and illness of the cheilitis in her lips. In the third and fourth session, the cheilitis embodied the traumatic experience and the non-elaborated block, as well as the ability of not being able to express emotion facilely. She cannot smile, she cannot laugh, she cannot cry, and any sort of expression in her face in which she could express emotions cause an extreme amount of pain in the skin, in the mouth. She cannot eat properly, she cannot open properly the mouth, and the patient has a memory of pain and isolation. The fifth and the sixth session with the sound and the images produced, she imagined a life outside the house, and she started programming me through the sound therapy, external situation in which she would like to be, like traveling, family life, and children. These therapy sessions became really intense, and it was possible to go through 2 years of therapy with the psychoacoustic, in which the patient used the sound therapy every time she came into the therapy, and she could also travel with that when she had difficulties, and this changed completely her life. The patient that wasn't able to travel, she wasn't actually even able to go to the supermarket, if we want to be really specific. She started to be more independent, to travel from the Netherlands to the US, to engage in wanting a family and succeed in a pregnancy. She can now smile, feel emotions again. She is, of course, still in contact with some pain that is managed, and also is perceived much less. She is no longer experiencing depression because she feels she has the life she wanted, and indeed she. But just to give you an idea of the verbalization that happened during the session, I would like to go a little bit deeper in the example of verbalization of case study 2. This is a verbalization of 19th of January, in which she realized that the first session has prepared her to go to the trip back to the US. Let's read it through, just quickly. The first session took me back to the city and the sensations of riding my bike along the park, the swimming pool, my desk at the Museum of Art, and I had very specific images of each of these places and being there. I felt the sensation of being that swimming pool, a place I used to go swimming almost every day during my last year living in that city. I felt free and weightless, and came out of the session thinking that it showed me it is okay to look back, and instead of feeling sad, to feel happy. Happy that those things happened and existed. What does it mean? It means that through the images, the patient is able to see the images, and instead to react with sadness, regret, melancholy, and depression, she take distance from the image. She see them like in a movie in which she's part of, and then she feels happy because those things has happened and existed in her life. This is a clear change of pattern from seeing towards a sad and regretful experience towards a happy moment that happened in her life, and a realization that she has been lucky to have experienced. But let's see the second verbalization of 20th of January. The second session seemed to train my mind to be like a Yeti and to be able to block certain things if necessary. It took me to places that I didn't want to go and I didn't want to think about, so I had to block it from happening. It took me to Asia and all the health problem that I went on. The itchy legs from spilling bug spray on them in Singapore, the upset stomach and nausea from eating bad fish, and you can read it all through. My mind literally created the images of a force field being created, and then I had the vision of all these memories that I didn't want to think about, yet crashing into a brick wall and being blocked. This is an exactly a clear image that the brain creates for her to be able to create a boundary towards negative thoughts. And then she continued, it took me to all the things that went wrong with my body, but then it showed me not to be afraid, because it showed me how I am in control of my mind, and no matter what, my mind will keep me safe. It's a learning process. By having the image of this brick wall separating the bad memories and the new experiences, she realizes that she can control her mind. No matter what, my mind will keep me safe. And let's go next quickly to the example of verbalization of case study 2, again 24th of January. This is the session right before the flight she had the next day, and she can see and envision exactly the situation in which she will be in the kitchen of the parents-in-law, and she experienced certain situation, and the 12th of February, she described that all happened exactly in the way she had envisioned in the session. So she basically trained her brain to be in certain scary situation for her, because social situations for her were very scary, and then by envisioning it she could prepare herself, and the situation went exactly the way she saw it before. And the last example of the verbalization of the 9th of March, she explained how easy it is for her to use this device, because she says that music has always been part of her life. The act of listening with big headphone, cancelling the world outside, and get her through her teenage years. So for her, this therapy connects exactly to a certain action of herself, put in the headphone, listen to music, immerse into a new world of sound. So basically, this kind of therapy is on a tangible level, put her in an action that she can understand, that is very important to her life, and that is easy for her brain to take in. And this is also a very important step for a client that is going to a new therapy, that we can offer something that the patient can understand, that is easy, and can put her in a situation in which she feels very comfortable. The last case, study 3 of the qualitative research on sound neuromodulation, is the case study of AA. Is a female, 37 years old, with bulimia, burnout, and OCD symptoms. During the psychoacoustic, she encountered a trauma. The patient experienced a profound forgotten trauma in which the father threatens to kill the mother by mimicking him with an unloaded gun. By listening to the sound, the patient relieved the resolution of the trauma. She imagined herself going to ask for help and save the mother. Experiences the emotional detachment and realizes that her life cannot depend on the continuous control that she had in her OCD. Control of time, for example, the time of therapy, the time of the work she was, the time of the gym. Everything had to be planned and at the same time. Of course, the associated visualization had the image of a waterfall, and then she saw vegetations and pink and beautiful flowers, and then this waterfall became a color stream, green, yellow, fuchsia, and orange, and then it became a hot shower, and then it became the sound of a hair dryer, and then she see the father drying her hair. So there is a new memory of this father that dry her hair when she is a child, and this is of course an image that changed completely the negative things of the previous experience and give a new memory. During the therapy, of course, this is in a way too short to explain all the process into a slide, but you can see how the images changes in the psychoacoustic and how this can lead to a realization and a consciousness step in which the patient can really see the situation, detach from the situation, and change the behavior in order to live better. She finds a new balance. The patient poetically document every session, describe them in detail. She start drawing some she's never done before, and looking at her point of view, she can decide to go outside the workplace a little bit earlier, to change the time of her appointment, and she's a little bit more free from obsessive partners and eating patterns, because also the control become less in the eating as well. The patient can take care of her own loneliness, and she joined also a salsa group, and the symptom of bulimia and the root of her bulimia that she could take care of was the loneliness. So the loneliness was creating the bulimia, and the bulimia was creating the control. So she starts feeling connected and reconnecting to something that she called that word that was, is, and will always be mine, but it was just as dusty as before. My conclusion in utilizing the psychoacoustic traditional sessions into the psychotherapy treatment of psychosomatic, which I'm doing in Amsterdam with my patients, is that the theory and the psychopathology in my sessions can really clearly be exactly the same as the scientific studies applied by Dr. Gubert Finsterle in Milan towards the bioelectrical measurements of the brain, because the clinical evidence shows exactly that there is a reset of the behavior, a new change in the adaptive behavior of the client towards his life, and reached health in many different pathologies. What I can say that I applied also this method towards a client which are highly skilled and high performer, and what happened especially immediately after the sessions, but also with the retuning, that due to the fact that the capability of decision making increases in the client, then of course in highly skilled clients, in patients which they have a highly demanding job, there are also higher results in their efficiency. For example, I have seen musicians improving their performances after the sound neuromodulation, and be faster in choosing the notes in their music playing. At the same time, by utilizing the same method with the burnout client, which have a highly demanding job in international companies here in Amsterdam, I have also seen the therapy being much shorter, and with shorter I mean short-term therapy of 2 weeks, or shorter therapy of 6 months instead of couple of years of treatment for burnout. And with this I mean that the client become ready to go back to work with the proper analysis and in-depth analysis of his own situation, in order for him or for her to change the behavior which lead to the burnout, for example. Of course, high performers are also very good in integrating immediately in their new pattern of life. the behavior, and this helps them, of course, in be immediately efficient. At the same time, I have also noticed that some clients do not realize immediately the changes, but in the long term they have positive feedback of family members or other colleagues, which they tell them that they are more calm, more reflective in their decision making, and of course much more integrated into reality. So as a conclusion, I can say that we can shorten the times of therapy, and we could lead the client into a healthier state of living in a shorter time with a much more efficient method.